come from? Come on, guys, where did they come from? Where does everything in the head come from? Neural crest. Ectomesenchyme.
Yes, neural crest. I know.
Didn't we?
Either it was one of the two.
I know we went through this 1,000 times. You know, as long as you're sitting here, I'm just going to tell you something. There's a recent paper that just came out. As a matter of fact, the author is in town now. And when I talked to her, this is so cool. There's something called pleiotropy, right? Pleiotropy is one gene affects a bunch of other stuff. So for years and years, we've been looking at Asians and American Indians. And we've been trying to make up stories about, well, they have, you know, straight, thick, shiny black hair, okay? And they have epicanthic eye folds, okay? And they have different sweat glands. And they have shovel-shaped incisors. Their central incisors have a hollow in the back, so we call them shovel-shaped. They have all these things, and we've been, oh, they have dry earwax instead of wet earwax. And you can't believe the number of stories people have made up about all this. Well, what she has done is to show that what selection hit on was probably the ability for a mother to transmit vitamin D through her milk. Because when you're in a high latitude, you don't get any sunlight. And even if you bleach out your skin so you can absorb what little sunlight there is, it's cold and you've got to cover yourself up in clothing. So it turns out that Asiatics that have this EDAR gene complex can transmit more vitamin D to the newborn infant. And with vitamin D, there's so many things that go wrong. Your whole immune system crashes, and you end up with rickets and all that sort of thing. But the rest of it came along for the ride. That's pleiotropy. All these things we've been trying to say, well, why do they have dry earwax instead of having wet earwax? Does anybody really care? Is it going to change your reproductive fitness? Is your mate going to say, oh man, your ears are wet, I'm out of here? I don't think so. So we now know that all those things just came along. And we can stop making up silly stories about it. Now, there is one thing that's kind of neat. Okay, humans sweat. We sweat a lot because that's the only way we can cool off. Not a good way to cool off, but it's our only way. There are two kinds of sweat glands, which incidentally, all these things are ectoderm, I might add. These are all ectodermal derivatives. Sweat glands and mammary glands and teeth, enamel, all this is ectoderm. So, there's two kinds of sweat glands. One is an eccrine sweat gland. It just lets water out. The other one is an apocrine sweat gland that also has fat and lets fat out, oil. Now the difference here is the oil, the fat, the lipid, attracts bacteria. And it also happens to be in your armpits, your axilla, as well as in your groin area, which is a perfect little place for bacteria to grow. And that's why humans are so stinky. And that's why we all use deodorant. But wait, folks, wait. If you go to the historical record, people notice, they made comments about, you know, the American Indian doesn't smell. Of course, the American Indians said, you Europeans are just awful. And the Japanese said the same thing. You know, they said, well, you guys just smell terrible. But you know why? Because we have both kinds of sweat glands, and we have a whole lot of the apocrine in our armpits. And that gives us body odor. Asians don't. They have eccrine glands. So they don't smell. But the sad thing is, this will give you an idea about, because on commercials, they tell you that you should be using deodorant. You guys spend as much money on deodorant as we do, but you don't need it. I mean, isn't that kind of cool? Remember, it's all ectoderm. It's all derived but from ectoderm, as all that stuff is.
Are those the same as sebaceous glands?
What?
Like sebaceous glands that release oils?
Yeah, they're called apical.
It's the same, those are interchangeable?
Yeah.
Oh,
Well, sebaceous is just an oil-producing gland.
okay. Oh, so sebaceous like the umbrella.
These are sweat glands.
Ah.
And that's why, and it's interesting, they cluster. They cluster in our armpits and our groin, which means that it's a perfect place for bacteria to grow. It's also where we kept hair. Remember, we lost hair everywhere else except our head. And we kept it in our armpits. Well, like, why would you keep hair in your armpits? Does that make any sense to anyone? Well, no, it doesn't make any sense unless you want those bacteria to grow. So I guess there's a period in our evolution when we liked body odor. Probably mate recognition. Okay, can someone load this for me? I know, I'm a pain in the ass about this, but that would just be a wonderful thing.
Abby's a note taker, right?
I've had a terrible week.
I like her name.
Yeah, sure, it's Latimer OH, OH1 or something. It should say today. You know, I just found out my best friend in graduate school just was diagnosed with pancreatic cancer. Bad. How do I know it?
No, is it sorry to hear that?
Yeah.
Oh, yeah, I just talked to him, it's very sad. Because that's not, well, pancreatic cancer, you don't bounce back. That's a tough one. So he was telling me what his symptoms were. And you know, when someone has a really bad disease like that starts telling you their symptoms, you know it as well as I do. You go like this, oh my God, really? You know, your fingers start to tingle, really? You know, you feel this and this, and like, you're starting, oh my God. Like when I took neuroanatomy, do you guys take neuro?
Yeah, next year.
Okay, well, they'll probably tell you. Oh, yeah, they certainly should. You should never bite your cheek or your tongue. I mean, there are feedback mechanisms in there to stop you from biting your cheek and your tongue. And you shouldn't get those little flick beak things in your eyelids like you do sometimes. You know, your eyelids go, and you can feel them.
Oh,
You can't
yeah.
really see them, but you can sure feel them. Well, anyway, those are symptoms of a brain tumor. So every one of us sitting in that class, I just remember sitting in that class and we're all looking at each other going, oh my God. You know, maybe I'll drop out now, because why go on? And how many times, come on, we all bite our tongue now and again. You can't, you know, it just, something went wrong in the feedback loop. But you're not supposed to bite your tongue. Oh, God, not this again. This will be quick. All I want you to remember, okay, remember the facial promontories. Boom, frontonasal, 2 maxillary, 2 mandibular, right? And they grow from about 4th week in utero to about 8th week. So they're in the embryology part of development. After the 9th week, it turns into the fetal. But so they're early, and oh God, where do they come from? They come from neural crest. And you remember neural crest? It's ectoderm that delaminates and migrates into the mesenchyme. The mesenchyme is usually mesoderm, and it becomes ectomesoderm. And this is really important stuff. It's really important stuff. If they don't migrate enough, all kinds of terrible things happen. If they don't come down into your face, oh, just a whole lot of horrible things happen. So, and you guys are going to see it too. I mean, you're going to have patients that come in that have neurocrestopathies, which is neurocrest
Under a folder that
pathologies.
says new PowerPoints and facial growth.
Thank you.
there's a whole bunch of slides on there that you don't even care about. Because I always just pack the back of my talks with slides that I can change them. Don't you guys do that too? Anyway, I guess not. Just me, huh? All right, well, you know, this is, you can see I didn't even change the date here. God, what is this? 2016. Anyway, the words, the important words are still important. Oh, God. This really, I'm just going to go through this quickly till we get to the face. And you're not going to get, I'm not going to test you on this stuff this time. Okay. You should have a rough idea of how it all happens. You know, just not magic. Yeah. Gastrulation is supposed to be the most important thing that happens in the rest of in all of your life. That's what the embryologist will tell you. I'm not sure it's true. I know you've seen this, but here's the important part of this. 3 layers. Ecto, endo, and meso. And when you've got that early plate, the neural plate, you have a bilaminar plate, which is just ectoderm and endoderm. And then meso, some of the ectoderm goes down in the neural groove, and that turns into mesoderm. And just know that the ectoderm turns into your central nervous system, your skin, your hair, your sweat glands, your mammary glands, all that kind of stuff. Mesoderm turns into bone and muscle primarily. Endoderm lines your gut. But here we get that, what's going on here is we create the neural tube. First of all, there's a neural groove here. The groove goes together and creates the neural tube. That's the notochord that stimulates it to do that. And then, then coming off that neural tube, you have neural crest cells. And those neural crest cells are normally, they laminate, they're epithelial, and they hold together, but they delaminate, and they start traveling all over the body. Only vertebrates have this, if you want to know. Makes a huge difference. So there you go, there's our neural groove. There's a notochord. That becomes the neural tube, and those are the neural crest cells that start to migrate around. I can't even stand this one. Okay, now here's what they do. They head down, first of all, what's important for you guys, they do millions of things. They make melanocytes, so they get all over your body. But they go to the arches, the pharyngeal arches. And they go into the arches, which are mesenchyme, and they go in there and they create ectomesenchyme. So it's a combination of ectoderm and mesoderm. And that's what gives rise to your face. Everything you're going to think about comes from this. And this is just the pharyngeal arches. They were originally gills. And that's where you get jaws. And your jaws, your maxilla and your mandible comes from the first pharyngeal arch. In order to form that, it forms around the early mouth. In embryology, it was called the stomadeum. And they form around the mouth first. So on the bottom of your mouth, you have the mandible and the mandibular prominences. On the top of your mouth, you have the maxillary prominences. And on the front of your forehead and the top of your nose, you have the frontonasal prominences. Now we'll skip that. This is the gill arches, which, you know, you really have to know. The first 2 are important. really important. The first one is what nerve goes, each arch has its own nerve supply, and each arch has its own artery, and the artery comes off the truncus arteriosus, which comes out of the forming heart, and it goes in there. And then the nerve supply comes down from the brain, from the ectoderm, which is developing in the brain, and goes in there. So in the first arch, you've got the trigeminal, right? You got to know that one. You'll be fighting that nerve for the rest of your life. The facial nerve is in the second. What's the third? What's the ninth cranial nerve? Louder?
Glossopharyngeal.
Yes, glossopharyngeal, yes. And what's the 10th cranial nerve?
Vegas.
Vagus. And what does Vegas mean? Why is it called Vegas?
It's a wanderer.
Yeah, it comes from vagrant, because it wanders all over. If you think about the recurrent laryngeal nerve, that gets wrapped around your heart and has to come back up to your larynx, that's a long way, particularly if you're a giraffe. That's a really long way to go. It's a long way for humans, too. Yeah, here we go. You know, it's lined on the inside in endoderm. On the outside, it's ectoderm. In the middle, it's mesoderm. They all have their own nerve. They all have their own artery. And the cartilage is mesenchyme. And that's where all this stuff starts coming from. So I said they used to be gills. Evolution doesn't invent anything new, or rarely does it. What it does is just, it tinkers with what it's got. A perfect example of this is this. If you don't like what your environment's doing to you, it can be too cold, it can be too hot. You can have things with big teeth chasing you around trying to eat you. You can, the toxins in your food, all kinds of things that are just pissing your body off. You're just mad at it. And you want to change things. You know what you can do? Two things. You can contract a muscle or secrete a hormone. That's it. That's it. It's just built upon that system. Your neurotransmitters are really just hormones. And your muscle contraction, well, yeah, we're still using the same muscles that fish use. Same muscles that tunicates use. So that's only two things. So we just build upon those systems. Which is why, if you want to get to where we are today, embryologically, you got to go through those early stages, because you keep building on the early stages. Now, once you do this thing, then remember the first arch is Meckel's cartilage. Second arch is Reichert's cartilage. But Meckel's cartilage is also called, first arch is also called the mandibular arch. I know I've said it 1,000 times, but just remember, because you will be tested on this. Meckel's cartilage forms a model that then is, the bone grows around it. But Meckel's cartilage itself does not grow into bone. No, the very top of it does, the most dorsal piece of it turns into the incus and the malleus, your earbone. Stapes comes from the second arch. I told you about that, didn't I? It's a really good story, that stapes. That comes from a jaw joint, the TMJ of a reptile, which moved into the ear. Anyway, they're intramembranous bones. I know Hans told you that. The difference between endochondral and membranous bones.
Mm-hmm.
So just remember that. Yeah, same old thing, you know. I mean, but it is important stuff. The fifth and the sixth are rudimentary. They kind of go away. We don't really use those anymore. But we do use the first four. They're important. You know, the third and the fourth form your hyoid. Your hyoid is an important bone. You know that, I just found this out. People with sleep apnea, their hyoid is lower in their neck. I have no idea why. But for some reason it's low. You can, one of the diagnostic features of people with sleep apnea. And only humans get sleep apnea. Except, I know somebody out there says, well, I had a dog that had it. Well, look what we did to the poor dog. I mean, we did horrible things to dogs. You know, we made their faces short. Like a bulldog? Well, no wonder it has sleep apnea. It has a face that's as flat as ours. We did weird things to ourselves. Yeah. I just even hate to go through this again, but repetition is good. So the mandible, the first arch turns into the maxilla and into the mandible. And it also forms the chewing muscles, the temporalis and the masseter. And that's why they get the same innervation. And the digastric too, half of the anterior digastric gets trigeminal, posterior digastric. What is a posterior digastric get? Glossopharyngeal? I think. But it's biphasic. Same thing with your sternocleidomastoid. All right, we'll get through this. I'm not. Well, the rest of the time you're in school, you're going to get hammered with this. So, but by now you probably have a pretty good handle on what each of these arches does, right?
Mm-hmm.
That's really not for today. This one is. Okay, we section through. Now, there's the first. Now you remember, on the internal surface you've got pouches. On the external surface you have clefts or grooves, it doesn't matter. They're coated in ecto, that is endo. Where they come together, that little piece where they come together is called the pharyngeal membrane. And it's where ectoderm and endoderm come together. The only place that's really important for us is that it forms the tympanic membrane, your eardrum. Here is the first arch. So those grow in together and they form internally the auditory tube. Externally they form the external auditory meatus, and the ectoderm forms your ear, your external ear. So if someone has a problem in this thing, they'll very often have deformed ears. The second arch grows down and essentially obliterates the clefts of the third and the fourth arch. And in so doing, it forms this thing called a sinus, cervical sinus. If that cervical sinus, you see this is along the neck, so it's nice and smooth once it grows down. If that continues, that's when you get the fistula in your neck. The parathyroid, all this is glandular tissue, which is endoderm. It migrates all around. It's not what we're after today. This is just, if you do get a fistula, it's always right in front of the sternocleidomastoid, and that just meant that you didn't have proper closing in that cervical sinus. Just where they show up. And remember, if you see that, check the ear, because the pedicle, or the external ear is likely to be deformed. Oh, that's not what I'm after. Yeah, it's thyroid gland, thyroglossal duct. Remember, the thyroid gland begins near the tongue, and it goes through the foramen cecum, that little hole in the back of your tongue, and you've got sulcus terminalis, that little V-shaped thing in the back of your tongue that divides the anterior 2/3 of your tongue and the posterior. Well, that's where the thyroid gland goes down in the thyroglossal duct. Oftentimes it doesn't get all the way down where it's supposed to in the neck, and it can show up at other places, or you can have a patent duct. It remains open. Okay, now finally to the face. Yeah, you know, this cranial vault. Everything here is intramembranous, and it's not everything, but almost everything. It's intramembranous, and it's membranous bone. The one big piece of it that's not is the occipital bone back here. There's also little tiny pieces up here along the zygomatic arch, but not to worry so much. What we're going to talk about is this area, that's the maxillary prominence, forms the zygomatic bone, and the maxilla, and the mandible, and then the bone up here, which is the frontonasal prominence. Yeah, we know that. So those prominences grow together, and by the 8th week in utero, the fetus truly begins to look like it has a face. Now, and it's doing that, here's the gut, the foregut. That's the mouth, that's the head, the brain, the growing brain, that's the cardiac bulge where your heart's growing. You get flexure in this thing. About the 4th week, it starts to flex. And you have a membrane there that's called the, well, here it's called the buccopharyngeal, it's also called the oropharyngeal membrane. And that is a piece of ectoderm and endoderm that have come together. It goes away quickly, and when it goes away about the 4th week, 5th week. And when it does that, it opens up the gut to the amniotic fluid. So within the placenta, you start getting the amniotic fluid back inside of the gut of the fetus. Well, let's not go there. Okay, you got to know this. These are the prominences. And I just threw in the nasolacrimal groove because we'll talk about that. That's where 2 areas come together. And when they do come together, what has to happen is normally you would have a layer of epithelium there that would stop the joining of the cells. Well, there's apoptosis, programmed cell death, and that goes away. And then they join together. The nasolacrimal duct runs from your eye, from the lacrimal gland in your eye, down into the antrum of your nose, the area in your nose. And that's why when you cry, your nose runs. I'm sure you've noticed that one time or another. Okay. Here we go. That's the frontonasal, your forehead and the top of your nose. Part of that, because it's frontonasal, are circle the nasal pit, or the nasal placode. Placode in embryology just means a thickened area of the tissue. These guys, what happens is they circle that placode, and you end up with a medial and a lateral nasal prominence. It's still part of the frontonasal prominence, but as it develops, it also becomes prominent, and it's called a prominence as well. So you end up with this median and this lateral prominence that surrounds the nasal pit. There's the stomadeum, what would be the mouth, the ears, the eyes way over here on the side, the ear is way down here on the neck. Does it have it? No, it doesn't show it. As they grow together, and they grow quickly, they grow together, and you get fusion of the medial nasal prominence into one piece, which is right here. You also get fusion of the lateral to the medial. So you get fusion here and here. That will eventually form the philtrum. It doesn't, and it also, not just the philtrum, but it also forms the, oh God. What's that little flap of skin? What's it called?
The frenulum.
Frenulum, thank you. Yes, frenulum. It forms the frenulum. Both these things, when they come together, you have a frenulum down here and a frenulum up here, and that's when they join. This just shows the same thing, same sequence. But the eyes migrate to the front, and the reason they migrate to the front, they're starting out over here like a fish, and they migrate to the front because as the brain expands, it literally pushes the eye to the front. And the brain goes laterally and pushes the eye out to the front. And your ear starts out on your neck, because remember, it's the first branchial arch that leads to the external auditorium hiatus. Well, what happens is your jaw then grows down, and your ear doesn't move. Your jaw grows down, and as it does that, the ear appears to migrate as it goes up the skull, but it doesn't really. But it does start on your neck. And this is, as these things grow together, the important piece of it is this. One is to form the roof of your mouth, to form your palate. Mammals have a hard palate. Not all animals have hard palates. But mammals do because in order to suck, which hence the name mammal, in order to suck milk, you have to have a hard palate. Otherwise, what will happen, you can't create negative pressure, and if you do create negative pressure, a lot of it will come out your nose. So we had to create the hard palate. Now the hard palate just means those are the maxillary prominences that grow together. And they meet in the midline. And that's what forms your primary palate and your secondary palate. Remember, you have a premaxilla where your incisors erupt. Behind the premaxilla, you have the palatine portion of your maxilla, and behind that, you have the palatine bone. This making sense? Behind that, and then even behind that, you have the soft palate. If those things do not fuse, that's when you have clefts, and that's when you have a problem. Number one, with a cleft palate, very often it's difficult for the child to suckle. It can't do it, and it can't create the pressure. What's more, if it does, it runs out its nose. It's very difficult to do that. So it becomes an issue. So what forms that, what allows that to form is as the mandible is growing, the mandible drops down. The mandible drops down, which means it pulls the tongue with it. Because prior to the tongue moving, you can't make the soft palate or the hard palate because they can't come together because the tongue's in the way. So you drop your face down, pull the tongue down, and humans have a gigantic tongue. You pull it down, and then you can form the hard palate. So at the same time, you also form the nasal concha. Once again, this is, and the ethmoid bone. So the maxillary prominence, as it grows together, forms the nasal concha, which is all those scroll work, and the ethmoid bone, and it also forms the cribriform plate. And the cribriform plate is where the first cranial nerve, the olfactory nerve, goes into the brain. And it's an interesting thing, I don't know if I told you, but the cribriform plate is always perpendicular to the nose. Meaning, in our case, it's flat. It's horizontal, and our nostrils point down. If you were to look at your dog, it's like that. Its nostrils point forward, and his cribriform plate is vertical. I have no idea why that's true, but it is true. Probably size of the brain, I don't know what it is. Anyway, so all of this goes together, and we create the nasal concha in our nose. Why do we have nasal concha in our nose? Well, that's because we're warm-blooded. And if you're warm-blooded, every time you breathe, you exhale, you're pushing out water, and you want to try to stop from dehydrating. So you put these scroll work in your nose that causes your nose causes the water to condense as it blows out. That's why your dog has a wet nose. And you can tell if a dog's not healthy that it has a dry nose. But a wet nose, or a wet rhinarium, is there to stop it from drying out. Why am I telling you this? Because it's very important. Humans dry out in a hurry. For those of you that like to run long distances, drink water. Lots of water. Humans are not meant to run long distances, and every year you hear about some poor football player who dies. Usually on a high school team because the coach is an idiot, makes these people work too hard in August in full uniform. And some guy dies. What kills you when you get heat stroke? What is it that kills you? Well, you've dehydrated. Your body tries to cool off. It's dumping all of its electrolytes, but more importantly, it's dumping all of its liquid. And so doing, the blood becomes so viscous that your heart can't push it, and you die of a heart attack and heart failure. That's what gets you when you die of this. So that's what all this has to do with why your mouth is wet, why your nose is wet. All of that has to do with where We have to maintain fluid in our body. If these things don't properly close, then you end up with clefts. And you can, you can look at this and you can say, well, what is that cleft? Well, you know that that's the maxillary. That would be the maxillary not fusing properly, and it's also over here, it's cleft because the lateral nasal prominence also hasn't fused properly. So you can get one right in the middle, that would be the two maxilla don't fuse properly. Interestingly, the mandible rarely clefts, but you do, the reason that you get a dimple in your chin, that's where it closes, and if it doesn't close all the way, you don't get, you get a dimple. Some people have a huge dimple, and that's why you get that little dimple in your chin, is where those things have grown together. And, okay, here's Meckel's cartilage. Just remember, it doesn't form the bone forms around it. And then it dissolves, except up here at the top, at the most dorsal portions of Meckel's cartilage, it turns to the incus and the malleus. So, I've told you this before, but it's important. If somebody comes in and if they have a fistula, or if someone comes in and they have a deformed ear, have them ask about their hearing. They probably have a problem with their hearing, because that means that the incus and the malleus probably didn't form properly. And, yeah, this is okay. A piece of Meckel's cartilage turns into this spinomandibular ligament. I don't know what that ligament does. You can cut it. It doesn't seem to do very much. But at any rate, that does form that. Trying to see. These aren't big enough to see very well. So, I'm just going to tell you. What do you have to know?
Yeah.
What you got to know are the facial prominences. 5 of them. Next time I'm going to talk about something else. I'm going to talk about sexual dimorphism, what occurs at puberty. Because there's a big difference between the human female face and the human male face. And cosmetics. What do you think cosmetics are for? What do they highlight? They're highlighting something. You're putting them on certain places of your face and you're not putting them on other places of your face. Why is that? Well, we'll talk about that. What happens at puberty? Why do males have bigger chins than females? Why do we have a chin in the first place? Well, all of it starts with these facial prominences. Know that that they come from neural crest. Know that the maxillary prominence and the mandibular come from the first branchial arch. Know that that's the trigeminal nerve. Know Meckel's cartilage is the first. Reichert's, which people don't like to use anymore. Reichert's is the second. That's the facial arch. Just know the prominences. If they don't grow together properly, then what happens? You end up with clefts. And unfortunately, you're going to see a lot of those in your life. Now, how do this is kind of neat. Jerry Goldberg, that used to be the dean here, used to do a wonderful thing. He would go to Ecuador, and for some reason, in Ecuador, they have a terrible, terrible time with clefts. I don't know this, but I'll bet it's probably something like heavy metals in their water or something. I don't know what it is. But anyway, they have a very high percentage of them. And so Jerry goes down there and he does surgery for free. I mean, that's a hell of a nice thing to do. He used to spend weeks down there doing these surgeries. And one of the things that he would have to do, if they got a hemimandible, or if one side of the mandible, or even the whole mandible, is very badly deformed, or if it's also hypoformed, meaning it's too small, they would graft a bone there. And the bone that they would graft would be a rib. So they take a rib from the kid, and they graft it into where the mandible would be. Okay, that makes sense. And I asked him, I said, well, what happens, does it turn into a mandible? He said, no, that's weird. this is the weird part. When the kid hits puberty and the bones start really growing quickly, it grows like a rib. Even though you took it out of the rib cage years ago, that bone remembers it's a rib and starts to grow like a rib, and they have to go in and do a secondary surgery to stop it from doing these weird things to the jaw. Isn't that strange?
Yeah.
So why would they use the bone graft from the rib?
Yeah, is it worth it?
Well, the theory here, if you talked about bone growth, like Moss, Melvin Moss?
Yes.
Okay, Melvin Moss's idea, and not just him, also Frost, said you can take a bone is bone. So you can take a bone from the foot and stick it in the jaw, and it'll grow to its surrounding. No, it's not true. It isn't true. What happens is that somehow it has a genetic memory, and it grows the way it's supposed to grow.
So when we do like implants with bovine bone grafts, why don't we end up turning into cows?
You know? Maybe you do, I don't know. No, that's a good question, I don't know.
So this is what you do, you steal someone else's hand.
Yeah, pretty soon you start chewing on your cut.
That's why I sleep with one eye open.
Which our teeth are
You
not
never
developed to
snatch
do.
a mandible.
So anyway, I've got to go visit my dying friend.
Aw,
So anyway, that's sad.
yeah.
Next time we'll talk about dimorphism and why human faces look different and all that kind of thing.
Okay.
You just know the facial prominences, that's all. And that's pretty simple. And if, you know, things can go awry, and because it's so early in the system, remember this is 48 weeks during that embryonic period, if something goes wrong that early, it'll cascade through the system. And then, you know, a lot of stuff can happen. If something happens, that's why the first trimester, if you're pregnant, go easy on any toxins. Don't even take any toxins if you can help it. Which is why women get morning sickness in the first trimester. The body's telling you, get this shit out of here, I don't want it. Because you're gonna hurt the kid. Don't drink. If your coffee makes you sick, don't take it. All of that. So all of this is an adaptation to let the poor little fetus grow. Go.
Would you like eating a toxin-free diet while pregnant would prevent morning sickness?
No, probably not.
It's like, what? Why
Some people
don't we
just
do
do it,
that
some
yet?
people don't.
Well, it would help it.
Okay.
Because, you know, there's certain, I mean, I can tell you, having, one time in my life lived with a pregnant woman, the very thought, not to mention the smell of broccoli, she'd spend all day vomiting.
Oh, no.
And there's a reason for that, because broccoli has a lot of toxins in it, as does cabbage, as does Brussels sprouts, which is the same thing. You know, that's why some people, I like cilantro.
I hate it.
I
It's
really do.
disgusting.
It's super tasty.
No, it's
But
bad.
people that don't like it hate it.
Yeah.
Some people they have like it's like genetic thing where it tastes like
Yeah, it's gross.
Yeah, yeah.
Super tasty.
That's what they say, it tastes like cinnamon. So, I mean, there's certain tastes that, and cilantro does have any bitter taste. A lot of people don't like it. So we could get started